How's everybody? Good to see you all here. Everybody's joining now. Hello, Dr. Hosseini. What is the criteria to attend this exam? Exactly. The next few slides, we will start at 6 p.m. and we will talk about the exact criteria, how you can apply, who can apply, what is the application procedure. We're going to talk about all that now. So you want to take some notes today. That's very important for you. And this is the right time to start the prep for the exam and to sit for the September exam. And the good thing is that there is no negative marking in this exam. So we strongly recommend that you would be wanting to finish the full 3 hours of the exam and can come, sort of complete all the 100 test papers, test questions, the single best answers that are being asked from you. While we are all gathering, so again, please continue with your question Q&As so that I would have a pretty good idea before I start what to talk about. And the other thing is just a little bit of talk about myself. Hi, Najla. How are you? Dr. Najla Adil is here. And Dr. Wajiha, I'm sure you're logged in and you can hear us. I hope you can hear us. Send me a hi in the chat if you can hear us, please. And Jacqueline, what about you, Dr. Jacqueline? And Dr. Usha, you can send me a yes or a hi. Yes. Yeah. Hi, Najla. How are you? So you're very much around. Well done. All right. Okay. So my name is Dr. Shazia Maqsood, and I am one of the new mentors for the Med Exam Expert. But hi Sidra, how are you? Welcome, dear. But for the exam itself, for the Mrcpi exam itself, I'm not new to the Mrcpi exams and also to the Mrcog exams. So in the coming few weeks and coming few months, you're going to see a lot of very nice and robust and very active changes in the curriculum, the way we are teaching, all the Mrcpi and Mrcog courses with the Med Exam Expert, inshallah. Hi, Dr. Maida. How are you? Very welcome. I'm Shazia. Nice to meet you. So a little bit of my introduction. I am an examiner for the Mrcpi for the OSCE, and I have a long affiliation with Ireland because after completing my degree from Pakistan, I left for Ireland and I have been trained over there. And I finished my Mrcpi, and then now I'm the fellow of the Royal College of Physicians of Ireland. Also, I did my Mrcog from UK, and now I'm the fellow of the RCOG as well. So a long affiliation, and where I'm working in Riyadh at the moment, I'm working in a hospital group, which is one of the biggest hospital group of the Gulf region. It's called Suleiman and Habib Medical Group, and the training program director for the residency training over here, and also the examiner for all your exams. And I pretty much have an idea how the question papers are set up. I pretty much have an idea of how things work in Ireland because I've worked and I've been trained over there. So today's session is going to be slightly different from what you have been, reading around or listening around from other groups, etc. That we will just hit, exactly, on the point how to crack the exam. And that is something very important. So anything that you would like to know extra, Dr. Sidra, Dr. Maida, just put it in the chat group for me so it will be easier for me to take your questions as we go along. And so I have some very nice stories to tell about my own Mrcpi experience and my own Mrcog experience as well. So part 2 Mrcpi, back in my days when I took my exams, it used to be on site, and you have to travel. So I was working in Dublin, and then I had to travel to another city called Galway. So how I entered training in Ireland, what was the procedure? Yes, Dr. Tabinda, I will tell you. There was a TRAS exam that I had passed, and then I went to Ireland directly from Pakistan. And then I got a locum in west of Ireland, and from there I started. After 3 months, they offered me a job, and and after 1 year, I got a number training job. So that's how I started in Ireland. So I had to travel from Dublin to Galway and stay there for 2 nights and give the exam and come back. Now it is so easy now that the exam is online. You guys are very lucky that you can take the exam in the comfort of your own houses or wherever you are comfortable with the working Wi-Fi. So this is something that has been explored all over the world. Doing the exams online, and this is the best time that all of us can pass this exam without without having the hassle to actually travel around, around the world, and not to mention also the visa processes. So that's very important as well. So we are going to talk about a lot of things which has taken place in terms of exam changes, and also we are going to talk about a lot of changes about exemption as well. Dr. Bajiha is asking, those who are exempted from MRCOG Part 1 or those who have passed MRCOG Part 1 can sit. Yeah, we're going to talk about all that. I have a list of what is being exempted, so we will talk about that. And the answer to your question is exemption from MRCOG Part 1, answer is no. And those who have passed the MRCOG Part 1, the answer is yes. So answer to half of your question, the first half is no, and the second half is yes. All right. Okay, let me see who else is online. Dr. Anam is there. Dr. Komal Rafi is there. Hello, Anam. Hello, Komal. Hello, Hi, Sagasim. Hello, Ramesh Zafar. Hello, Ayman. How are you all? Let yourself known. Either open the voice box, either open the microphone, or write down in the chat. Let me know how you guys are doing. How's your prep going on so far? Who is giving the exam? Who's attempting the exam the first time? Who is attempting the exam the second time or more? Just let yourself know so that we develop a sort of an ice-breaking session before we start on the more serious of the nitty-gritties of the exam. All right, okay, and let's see. So where are you from, Dr. Ayman? Would you like to let us know? Lights to everyone, me for the first time. Hello, Lights. Welcome, and very welcome, and also wish you all the very best, and hopefully today's session will be very beneficial for you and for everybody else as well. I had a lovely time preparing the slides for this session, in the last 24 hours, and I was really excited because you remember your time when you are giving the exam, and then time flies. I'm a very primitive person, by the way. Okay. So good luck, Najla. That's the thing. It's the percentile system of marking, and then that is why we need to attempt all the questions, so that always remember that those questions which we are finding harder, everybody will find harder. But at least we need to do good in those questions which everybody will find easy, and we'll talk about that, during our talk. Another 2 minutes, and then we will start officially, inshallah. And Vajia, no, it is not the same pattern as MRCOG, because the questions are not that long as you would see in MRCOG2, and a single best answer. And the most important thing is, there are certain differences when you are preparing for the exam, because there are differences in exam prep as well, and we'll talk about it. Hello, welcome, Dr. Shami. Welcome, Najla. Kaif al hal? Masa al khair. And welcome, everybody. Sorry, I want to ask OSCE when will be held. All right, Najla. Yeah. It's very good to run ahead of time, but yes, we have good news for OSCE as well. We will be doing online, we will be doing on-site mocks in different cities of the world, including Riyadh, including Dubai, and including Pakistan. So you can join whichever one is suitable for you. And what advantages do I get after clearing MRCP? Yes, yeah. Sidra, this is a very good question, and I will answer that question in my talk. And also, I am Shazia. You can call me Shazia. No need to call me ma'am, madam. There's no ma'am and madam. We are all colleagues for each other, all right? And so coming back to a little bit to my Irish journey then. So I passed my MRCPI 1 in 2002. So yes, I'm a very primitive doctor. And then I got my fellowship back in 2018, alhamdulillah. And it's been a nice career journey, because after finishing work and after finishing my training in Ireland, I worked in west of Ireland, I worked in Central Ireland, and I worked in Dublin, especially there are 3 big hospitals in Dublin. One of them is the Rotunda Hospital, the other one is the Coombe Hospital, Coombe Women Hospital, and the other one is the Holly Street, or the National Maternity Hospital. So I worked in one of the hospitals called Rotunda Hospital, and that gave me a huge insight into teaching, curriculums, how to set the paper, how to set the question, what needs to get asked, what needs to be omitted, how to sort of rotate the question pool, etc., how to set the OSCEs, how to, there are a lot of things. So I am one of the examiners for OSCE as well, and I am actually the convener for the MRCPI exams in Saudi Arabia. So there's only one center in Saudi Arabia for MRCPI Ops and Gynae exam, and that is at Sulaiman Al Habib in Riyadh, in Al Rayyan branch on Khores Road, and I'm the convener for that exam as well. We just finished a beautiful exam just last weekend, And before that, we just finished the Med Exam Expert, mock OSCE, mock MRCPI, and MRCOG OSCEs in the same center. So there's a lot going on with Med Exam Expert. There's a lot of new things coming up. So just keep your tab, keep your tab on what we are here to offer. Okay. Those who had a wide gap between basic graduation and attempts, is there any limitation? So again, we are going to answer all these questions for you. Now, without much further ado, I believe we have everybody. So sit tight, hold tight, and what I'm going to do is I'm going to start the talk for you guys now. So for a minute, I'm just going to minimize the chat for you, and then let's start. All right. Okay. So what we need to do over here is that first we need to learn that MRCOG is a degree. It is an internationally recognized degree. That's the most important thing. And the Royal College of Physicians of Ireland is giving this degree, and you can fast track your medical career by just doing this degree. So most of us, when we are sitting for an exam, we are thinking, will I be able to do that? Can I do that? What if I don't pass? What if this and what if that? So all the doubts and the nervousness that we have about an exam today, hopefully by the end of today's talk, we are going to clear out all the doubts in your head, and we are going to make you a very positive person to be able to attempt to crack the exam. All right. So as we said, this is an international qualification. So one of you were asking me, Wajiha and Sidra were asking me about the issue about the exam. So if this MRCPI exam, now let me tell you a very practical tip. It's an international qualification. It is recognized worldwide. It trains you to be safe and efficient at work. Believe you me, when you pass this exam and when you go back to your work, you will say to yourself in your head, oh boy, I am now talking in terms of safety, and I'm talking in terms of quality as well. And yes, it is recognized. It is recognized all over the Gulf, and it is recognized all over the world as well. And it is helpful for your successful job interviews and good salary prospect as well. So I can give you a sort of a side note over there, although we should not be discussing salaries or anything like that. But I had a huge advantage when I was hired from the UK, and I had an MRCPI and MRCOG degree, that I had no problem getting hired in Saudi Arabia, and I do get a higher degree allowance for the 2 degrees that I have. Okay, so that's all good news for you guys. So let's see now. Are there any other questions? None so far. All right, okay. So what are we going to do with each other? Now let's work together. We are going to arrange live sessions, and I am going to take your live sessions myself, and we are going to talk about the Irish HSE guideline summaries. We are going to talk about a very important thing, because some of you, or rather most of you, are used to giving MRCPI and MRCOG exam together. So that is very important, that, when we are talking about giving exam together, and when you're actually in the exam, then we need to know that what are the differences, especially when we are attempting the answer, or when we are attempting to, talk about the answers in both the exams. So there are slight differences. And yes, we will give you flashcards about what's the difference between UK and Irish guideline. And I've prepared a couple of slides for you today as well, just so that you have an idea. We will give you the session recordings as well up until you pass your exam. Yes, I'm coming to the exam pattern, Irsa. Very welcome, Dr. Irsa, and the next few slides have the exam pattern. We'll also talk about BASHH, Green Top Guidelines, TOGs, NICE guidelines, fertility and sexual reproductive health guidelines, summaries, videos, and study cards. And we'll also talk about scientific impact papers, which the RCPI release every now and again. So that's very important as well. And we will also be giving you the question pools based on all guidelines. We will talk about Irish exam focused preparation. We'll talk about study groups on Telegram and WhatsApp both. And there will be a 24-hour faculty support. it will be myself and it will be Dr. Tahira. We will be your mentors, and we will be very active with you for the next couple of months until your exam, on Telegram and on WhatsApp as well. We will be doing mocks, and we will be doing one-on-one preparation, and we will do pre-exam crash revision and moral boosters as well. All right, okay. So this is your exam format then. There is one paper, and you have 100 single best answers. There are 3 hours, and there is no negative marking. So therefore, you're strongly advised to answer every question, please, since there is no negative marking. All right, okay. Dr. Shami Ashraf is asking, after clearing part 2 written Mrcpi, may I be able to get any job in Ireland so that I do a job alongside prepare for OSCE from Pakistan? We can discuss that, after I finish this. Yes, the job prospects are there, but you need to talk to the job people in Pakistan, which is the headhunters in Pakistan. And just message me by the side on WhatsApp, and I can give you some headhunters' names in Pakistan as well. All right, okay, so what else is there? So the entry requirements, some of you were asking about the entry requirements. So the candidates for the Mrcpi Obstetrics and Gynecology Part 2 examination, you are eligible to apply once you have achieved one of the required Part 1 or the equivalent listed on the next slide. Additionally, you should have completed 18 months of post-registration training in a recognized post, either 9 months in obstetrics and 9 in gynecology or in combined. So you do need an 18 months of testimonial from the hospital that you're working, that you have been working for 1.5 years in OB-GYN. You must pass the Part 2 obstetrics and gynecology written examination before applying for the OSCE or the clinical examination. And the candidates sitting for the Mrcpi Obs and Gynae exam, you will be allowed a maximum of 6 attempts for each of the components. So for your written component, maximum of 6 attempts, and the time limit to pass is 6 years. And for the OSCE, again, the maximum is 6 attempts, but the time limit to pass is 3 years. Are we clear on that? Shall I move on? Anybody say yes in the box, in the chat box, so I can move on? All right, okay. Okay. Great. All right, so equivalent qualification. So many of you have asked about the equivalent qualification. So again, if you have done an MRCOG Part 1, then you can apply for Mrcpi Part 2 written, yes. But if you have had an exemption from MRCOG Part 1, that is not accepted. If you're working in Ireland at the moment, the RCPI Professional Diploma in ONG, or the Part 1 Mrcpi in General Pediatrics and Medicine would do, but that has to be within the last 6 years. If you're coming from Pakistan and if your FCP has passed in Obs and Gynae, then yes, you are exempted. Australia, similarly New Zealand, similarly South Africa, similarly Malaysia. So are we very clear about this? Is OSCE prep being done in Pakistan? Inshallah, yes, Irsa, it will be done. I have passed MRCOG 1 in 2017. Yes, you will be eligible. Yes, you will be eligible. You can write to the college as well. And if there's any problem, now one good thing, for taking up, today's talk is that because I can also, I'll tell you in the end. I have a few gifts for you guys. I'll tell you in the end then. All right. Okay, so next slide. So this is a very important slide. I just took a sort of a screenshot from the college website for the timings of your exam. So somebody was asking, when am I able to apply? So 12 June. Today is the last day of May. So in 12 days, the dates are going to open. That's your opening date, 12th of June, okay? So remember that, please. And then the closing date is Wednesday, 17th of July. But of course, you're requested to apply as soon as possible. So if by the end of this talk today, and if you have made up your mind that, yes, you're going to sit for the exam for September, please make sure that you're ready on Wednesday, 12th of June. From the morning. Remember, there is a 2 to 3 hours difference between, you just check wherever you are, what's the difference between the Irish time and where you are, and then be ready at 9 a.m. Irish time on that day, okay? And then your exam date is 5th of September, Thursday, the 5th of September. So you have the whole of June, whole of July, and August. So 3 months to go through the exam curriculum, to go through the SBAs. And I'm sure that by the end of it, you're going to rock it. Okay, 2011 you have passed. If it's more than 6 years, no, Wajiha. If it's more than 6 years, then no. All right, okay. So how to apply? All exam applications are submitted online through the Mrcpi website. So make sure that on 12th of June, you have a good working Wi-Fi, and you'll be prompted to include the required documentation and make payment as required for the examination. The college accept payment by credit and debit card or PayPal only. So keep a credit card ready, please. Applications after the published closing date will not be accepted. And how to apply? For the first time applications, for the first time candidates, I know most of you over here are the first time candidates as well, you need to have an attested or a certified copy of your original MD or MBBS degree. Number 2, you need to have a copy of your Part 1 or equivalent qualification. Number 3, for MRCOG Part 1, you will need your official Part 1 pass letter. And for FCPS and others, you will need the official parchment diploma. So have them scan, have them ready, make a folder on your computer, no excuses that you did not know that, now you do. And you need a testimonial form, which is on the website, completed and signed by 2 referees. I'll show you what the testimonial form is like. When you go on the website, you can click on the testimonial form, you can print it, and you have to have 2 referees. Also, you need to have a passport style photo, color, full face, 100 by 100 pixel with a neutral background, ready to upload on your computer. This is what the testimonial form looks like. You need to have 2 referees who can talk about you, and over here will be your full name that one of the referees can write, and at the bottom the referee 1 and referee 2 can sign for you. For those of you, so this is one of my gifts. For those of you who cannot find somebody to sign, please send your forms to me and I'll be more than glad to sign. Me and Tahira, we are both members and fellows, so we can both sign for you. Okay, so that's your first gift. And then the examination format, I'm going to repeat that again. 1 paper, 100 SBAs, 3 hours, no negative marking. Please attempt each and every one. Okay, and then let's go back to the next slide. And who can attest your primary qualification? Remember, you need to get your degree attested. So as usual, you can get it by a solicitor or a notary public or a lawyer. Or if you're in Ireland or Britain, you can go to, if you're in Ireland, you can go to the An Garda Síochána, which is the Irish police station, or you can go to any Irish or British consulate in your country of origin, or a commissioner for oath, or your own university or medical school. So I have quite a few chats. Document attestation by whom in Pakistan? All right, okay. So document attestation, it can be by the solicitor, notary public. In Pakistan, notary public, the first and the foremost thing. How quick is that? You just go to any notary public lawyer outside the small courts, and it can be easily done over there. So for those who are in Ireland, like I remember I got mine done from the Garda office. Garda is the police station office. So again, that's your primary qualification degree attestation. That should be no big deal. But you have 12 days from now onwards to make sure all your documents are ready. And you have made a folder, My Mrcpi, on your desktop. So the morning of the examination, when the applications are open, you're ready to just simply upload them. You're welcome, Dr. Sadia. All right, okay. So now this exam is, the blessing is, for all of us living outside Ireland, is that this exam is remote invigilation. And the company that is providing this exam online is called Test Reach. And this remote invigilation, which allows you to sit in the computer in your own home, this is one of the blessings. So you do not need to worry about the visa. You do not need to worry about your tickets. You do not need to worry about anything, just to have a good Wi-Fi, a completely closed room with no distractions, no cameras, no surroundings. Camera, I mean no extra camera other than the camera that you're looking at me right now. But you will be supervised remotely by invigilator and supervisors through the exam. But do not get nervous that somebody is watching you. You just focus on your exam because it is an exam that is easily crackable. So this is what the test reach website looks like. And when the time comes, once you're accepted for the exam, you will be receiving emails from them. And the first email you will receive by the test reach will be approximately 10 days prior to your exam date. So your exam is in September. So end of August, expect them to send you an email. And then your login credentials and instructions to download the exam application. So you use the same device that you're planning to do the exam on the same device you log in and you put in your credentials. Then you will receive a second email. It will notify you that you have been assigned for the exam. Now, this one, pay very important attention that they will tell you on this second email how to test your device, how to check your webcam, how to check your microphone, your speaker, and you will be asked to book a slot time to start your examination. So be ready to book the slot time. Okay, Dr. Lawley is asking, is there any approved translation center or it have to be original in English by the medical faculty? So if, if your degree is not in English, you can get it translated with the same notary that you're going for attestation. They will be able to tell you who are the notified translators as well. So coming back to number 4 on this slide, login instructions to the application and how to test your device, webcam, microphone, and speakers will be given to you. You will be asked to book a time slot, and the start time of the examination is based on your location and time setting on your laptop, on your device. So I have posted this in red because this is very important. Without this, whatever is red on this, without this, you will not be able to attempt the exam. Please complete this step at least 3 days ahead of the exam. Otherwise, you will not be able to sit. And on the day of examination, you will be instructed to log into the exam application at least a 15-minute before the start time. And if you're late, I'm sorry, they're not going to allow you in. So be very careful, to be punctual. And this is to allow the time to connect with the invigilator and, just to have a pre-check, pre-validation process, proof of identity. You can keep your passport with you. You can keep your driving license with you before the beginning of the exam. All right. And any candidates who arrive late or log in after their allocated registration time, unfortunately, they lose the plot. When the booking is open, of course, I can repeat, darling. All right. Okay. Let's go back to the previous slide. Okay. And take note again. All right. So the booking opens on Wednesday, 12th of June and closes 17th of July. And your exam is on Thursday, 5th of September. Agreed? Let's move on. All righty then. And on the exam day requirement, ooh la la. Now, the first and the foremost thing is all the exams that I have given, and I am requesting you guys to please listen to this request. I have passed all my exams in the first go, alhamdulillah. I will always sleep 10 p.m. on the night of exam, not more. I will stop studying 8 p.m. and we will have a good 8-hour sleep for the last 2 days preceding the exam. So please fix your sleep cycle, because when you are asleep, when you wake up after an 8-hour sleep, you are able to recall more. Trust me on this one, all right? Now, on the exam day, of course, you will be on the device that you have logged into. You please have a reliable internet Wi-Fi connection, a webcam, and a microphone. If you do have any distractions at home, like any pets or any children or any relatives or any guest, you need to take care of that before you sit for the exam ahead of time. So if you feel that, things are not easy for you at home, you can come into a hotel where there's a good working Wi-Fi and you can attempt for the exam in a hotel, or whatever way suits you. Send your kids or send your spouses or send your family for an outing, while you're attempting the exam, or whatever suits you. Now, multiple screens are not permitted. So when the invigilator will check, they will ask you to take your webcam and move your computer around so that they can see the whole room. So please do not put 2 screens. So that's not permitted and you will be disqualified. Your mobile phone should be within reach in the room where you're sitting the exam, but it should be on silent. This phone is only for registration and technical support purposes only. So it should be on silent, no phone calls from outside. And then it should, as I said, it should be a quiet, secure room without interruption. You should be the only person in the room. It should not have any integrated security cameras around or any recording equipments other than the webcam on or PC or laptop. Otherwise, you will be disqualified. And you must ensure that you will not be disturbed during the exam, example by traffic, construction work, or people. And an extra request is take care of your diet the week preceding the exam. All right. Do not eat any junk food from outside that you fall sick. We just had a small problem during the exam last week that a candidate, she finished her long case and she could not finish her short case, and she was so dehydrated that she had to be sent to the ER, and she had to cancel her exam that day. The college has forwarded her fees to the next attempt, so they're not going to charge her anything extra. But it was really sad to see her because she was such a good candidate. So make sure that you look after your health in the week always, and also specifically in the week preceding the exam, and your sleep as well, please. Can we keep some snacks with us during the exam? Absolutely, you can. And any expression of interest we have to show for this as in MRCOG. Expression of interest, Dr. Isra, this is a written exam. I don't know, are you talking about OSCE? Because that's where you need to have more expressive sort of an exam. I could not understand the question. Could you rephrase it perhaps? All righty, okay. So this is how your screen is going to look like on the exam day. And there will be an invigilator. So this is the invigilator screen at the bottom. They will be talking to you if needed. Overall, they will not disturb you. Now, this is a very interesting slide. You want to take out your camera phones and take this barcode because these are all the frequently asked questions about the test reach that you're asking me. All right, okay. So are you all done with the screen? Taking the screenshot? For the FAQs, just post in the chat yes, and then I can move ahead. All right, great. Thank you, Dr. Maria. How are you, Dr. Maria? You're good? Only test form. Yes, yeah. Okay, thank you, Rose, for answering that for me. Okay, so just take a short break. Let me see who else is there online. Let's have a look at, okay, we have about 45 participants right now. Let's see. I think I have a couple of our students there as well that I'm seeing. Hi, Dr. Sajila, how are you? And hi, Dr. Tahira. Hi, Dr. Uzma. Oh God, oh my God, this is so lovely to have you all online. Dr. Uzma, can you unmute yourself? Dr. Nafia, thank you for joining us.
Assalamu alaikum, Dr. Shazia.
Hi, walaikum assalam. How are you? So what was your experience with the Mrcpi written? Would you like to tell everybody? Dr. Uzma is one of our students, from the previous exams. She has just passed her Mrcpi written exam and will be a candidate for our OSCE, inshallah. So would love to hear from you, Dr. Uzma.
Yeah, sure. Actually, at the moment, you know very well, like I'm not very much expressive. I cannot express enough gratitude of your guidance and support. But really, Dr. Shazia, you helped me a lot. You told me how to prepare myself. Like I was lacking in everything, and you told me, yeah. Really, really, Dr. Shazia, like I'm deeply grateful for the time and effort you have invested in me, and you're exceptionally talented and born mentor. Really, I appreciate your effort all the time.
I'm just humbled. I'm so glad that we sat that day and we gave the fees and everything was in process. And I think Dr. Nafia,
and you were the one who signed for me.
Well.
And you were the one who signed for me. I'm so lucky. I'm so lucky. Really, really.
That's what my gift is for every one of you who are participating today. That I can sign for you guys if you are finding problem in getting a professional person to sign your testimonial.
Yeah, and my message for everyone, like you are in very good hands, Dr. Shazia. She's a very good mentor. She will teach you. She will guide you how to prepare the exam and how you can crack this exam in one attempt.
Thank you very much, Dr. Uzma. Dr. Nafia, are you online? Dr. Sajila, are you online?
Yes, Assalamu alaikum, Shazia.
Walaikum assalam. Okay, let me introduce Dr. Sajila. Dr. Sajila is also an Mrcpi OSCE examiner. So you guys are very lucky that you're actually sitting with professional people over here who actually knows what happens inside the exam room there. Dr. Sajila, what is your experience about, like, working with me, and, like, just a little bit background. Would you like to say 2 minutes only? Yes, yeah, thank you.
Thank you very much, Dr. Shazia, for giving me this opportunity. Actually, I just want to thank you first that you are the one who encouraged us to come forward and to have an experience as an examiner, which was a great opportunity.
Love you, sweetie.
And last year, the last year was the first time, and it was, the first time we all were confused, and that was the first time in Saudi Arabia we were going to have an exam. And that was really a great opportunity. And this was the second time, and I felt that was the great opportunity we had. And we really thoroughly enjoyed the exam. And
Yes.
I'm just want to tell these girls that anytime if they need any help, so Shazia is the best choice, and we are also with her for any kind of help, and we are here to.
Thank you so very much, Sajila. Thank you. I bless you, bless you. So Dr. Sajila's story, and Dr. Tahira, are you online? Can you unmute yourself? Thank you very much, Sajila. Love you. Thank you.
Hello, Dr. Shazia. Hello, everyone.
Hello, Dr. Tahira. I'm now. So Dr. Tahira and Dr. Sajila's, journeys are very much similar. And, these are success stories that I want to share with you guys, that we started, working, and then we have passed our MRCOG, we have passed our MRCPI, we have progressed in our careers from a senior registrar, we have become consultants. So for whoever of you were asking me, is MRCPI worth it? So they are the living, telling tales of, the certification that, yes, this exam is worth it. Dr. Tahira, floor to you.
Thank you, Dr. Shazia. First of all, I would like to say thanks to Dr. Shazia for always encouraging. I remember the day when I passed my MRCOG and I was thinking, I'm done. Dr. Shazia was the only person who was telling me, go ahead with the MRCPI. And literally for 2 minutes, I'm looking on her, what she's saying. I'm done with MRCOG. I should not do MRCPI. This was my thinking, actually. But I listened to her. And today, after finishing my MRCPI, I'm thinking she was right. It's really worth to do MRCPI, and it's a good idea if you're doing MRCOG and MRCPI together, especially when you are working in the Middle East. It is really helpful in your career, as well as if you're looking for the good salary also, in both ways. So I think we should go for it. And second thing, you are in the safe hands. Dr. Shazia is the best mentor. I remember with the busy schedule, and I was working as a full-time consultant. She always encouraged me, and I'm always thinking how I will do it. But she made it possible that I can do it. I'm really thankful, and I don't have words to say thanks for that.
God bless you, Dr. Tahira. And Dr. Nafia, we're going to come to you in the end, inshallah, because you also have a very beautiful success story. So, so coming back to, thank you very much, everybody. Dr. Tahira, love you. Thank you very much. Yes, hello.
Good evening, Dr. Shazia. I'm Dr. Nafia.
Hi, Dr. Nafia. Just hold on to the thought. We'll come to the end, and we'll get you on board, inshallah. Thank you very much.
Okay, fine. Thank you.
Okay. So coming back to the examination format, again, one paper, 3 hours, 100 single best answers, and it is doable wherever you are working, because you have heard from people now who have passed their exams, who have progressed in their careers, that, these people are working daily in a very busy OB/GYN setup. Where Dr. Sajila is working, it is about 5,000 deliveries per year. Where Dr. Tahira is working, where Dr. Uzma is working, where Dr. Nafia is working, there are more than 7,000 to 8,000 deliveries per year. So you can imagine the work caseload. But still, with that, they managed to pass their exams in the first go. So that is the most important message that needs to go to you all aspiring new candidates, that the most important thing is your focus on the exam, your focus on your goal. I have one hand raised. Who could that be?
Hello, I'm Dr. Rehab. I want to share my experience.
Hi, Dr. Rehab. How are you?
Fine, Dr.
Welcome. Welcome. Yes, yeah.
Yes, I just would like to share my experience with you as a mentor. She's really precise and very, very, very helpful, doctor. She helped me in my studies, and she was always behind me. She was always supporting me.
So humbling. You
Even
guys are
when I was
making us look so good. God bless
even
you.
when I was low, no, she was always behind me. I cannot tell any word to tell how she helped me. Really, she's a very, very good mentor. She knows where to
God bless
highlight.
you. God bless you, Rehab. The success story of all our girls. Thank you very much, Dr. Rehab. Well done. You are a shining star, mashallah. The success story of this RCPI is that when we became an exam center, we also became a course center. And we became, that's how everybody got interested in this exam and everybody started focusing on these exams. Now, without much further ado, that was a humbling experience, everybody. All my students, mashallah, and God bless you all, and may you always prosper and always flourish and have a happy, hale and hearty life ahead, inshallah. Now, so
Hi, Dr. Shazia. How are you?
who's this? Hello.
Asa.
Hello, Aksa. How are you?
Fine, Dr. Shazia. I love you so much.
Habibti, we love you. We love
Dr.
you so
Shazia.
much.
Dr. Shazia helped me and Rahab and our group
Oh my God. Yes.
in OSCE exam, and alhamdulillah, boss. All your instruction, you told us everything about diet, about sleep, about not about only information or how to pass the exam. You take care of everything before the exam.
Thank you so very much, darling.
You are the best.
Thank you so very much, darling. And let me introduce everybody to Dr. Azza. When she came for the first day of the course, at the end of the day, I told her, Azza, you're going to pass. That's how good she was. Yes, yeah.
Actually, yes, this time my hospital, they told me we will not give you vacation. And I told you, doctor, I'll not go to this exam. You told me you will pass. Don't worry. Go to the exam.
And you had health problems, you had work problems, and still you conquered those hurdles. So well done, bravo aleki.
Alhamdulillah. Thank you, Dr. Shazia.
Thank you. Bye. Okay, bye. So thank you very much, everybody. So now coming to the exam result, there's a 4-week wait for the exam result. And what we do is, because it's an online result, it goes directly to the college and we are tabulating, we are calculating everything. It's a percentile. One of you mentioned that, you received that mark and you did not pass that year. So if every candidate, appears to have good marking, then the percentile will increase. And if there has been a difficult question that year, then the percentile comes down. So it's a percentile thing. And that is why it is very important that when you are stuck on a question, come back to it. And always remember your intuition. Intuition means that when you think in your head, when you're performing, that the first answer was right, usually that is right. But because you're overthinking, sometimes you go and mark it wrong as well. So be very careful about that. And when we are doing our course, we'll talk about that in detail as well. By the way, the OSCE that we did last week, the college is meeting. We are meeting them online in the first week of June to finalize the results. So good luck to everybody who has appeared in the OSCE last week. All right. Okay, and then we will just. Okay, so we have these preparatory resources. The Health Services Executive, or the HSE guidelines in obstetrics and gynecology are there. When you go on the RCPI website, when you or when you say RCPI in Mrcpi in obstetrics and gynecology, it will open that page for you. But don't worry, we have got everything summarized for you in our upcoming course. We'll talk about the preparatory books, we'll talk about the Green Top guidelines, we'll talk about the training ops and gynae journals, we'll talk about the FSRH updates, and we'll talk about the NICE guidelines as well. These are the preparatory resources, some good websites that you want to talk about. I'm not sure whether you're familiar with that or not. One is, of course, the Institute of Obstetrician and Gynecologists by the Royal College. They have every resource possible for your exam, because that's the RCPI based website. The other things are the 3 big hospitals in Dublin. I want you to please go and check their website. These are the rotunda.ie, coombe.ie, NMH or National Maternity Hospital.ie. And also there is a newspaper online which is called Irish Medical Times, IMT.ie. So all these resources online, you will be able to speak the language of Irish exam. You will be able to know exactly what's the nitty-gritty. We are the examiners setting the paper according to what's happening in Dublin, what's happening in Galway, in Limerick. in Ireland in general. So if there is any, say for instance, corona issue, or if there's any monkeypox issue, or if there's any chickenpox issue, be sure that these kind of, SBAs will be there, or the OSCEs will be there. So that's very important that you understand the nitty-gritty of how things work in Ireland as well. Alrighty, okay. So these websites will be very good for you. I think I was talking to one of our students the other day, and I told her, I said, if you want to polish your Irish English, then you need to go on these websites and listen to the vlogs. And one very important thing on all these three hospital website is patient information leaflets. All these three, Rotunda, Coombs, and National Maternity, they have excellent patient information leaflet. So when you are talking about in your SBAs, or when you are talking about your clinical knowledge and your communication in the OSCEs, it will be of great help to you. And it will be in an Irish way, not a British way, because there is a subtle difference between the two exams as well. So I think somebody has their hand raised. Can I see that? Who has their hand raised? You can unmute yourself, darling, and ask the question if you have. Okay, so this is the website for the college, Institute of Obstetrician and Gynecologist. And if you can see at the bottom over here, there's your national clinical guidelines all given over there, okay? Then these are the books. And I'm sure most of you are aware of these books. There are so many authors that it's difficult to grab a hold of all these books. There are PDFs available. We'll help you with them. There's Amanda Jones, there's Andrew Shiza, there's Rekha, there's Chinmay, there's, of course, the infamous Mr. Justin Konji, Sharmishta Goha, there's Brian McGowan, there's Srilata Datta, and there's Adil Al-Qadi. So all these books are handful for you. We have at Med Exam Expert, the course prepared for you with the pool, with the actual recalls, with the help of these actual recalls, we'll be able to get you prepared for these. So again, we will be doing all these works together. The live sessions, the guidelines, the summaries, the comparison between UK and Irish line, the scientific impact paper, the study cards or the flashcard, what you say, the summary videos, etc. And session recording as well will be available to you. And we'll be giving you the question pool. We'll be giving you an Irish focus preparation, study groups on Telegram and WhatsApp, 24-hour faculty support. And I love to do a one-on-one mock towards the end of the course and exam crash revision. And I love to talk about moral boosting because that's what needed, at the end of the day. So these are some of your dates. We are going to start from the 5th of June, and I'll be taking live session on all your modules and your topics. And the timing is 3 p.m. GMT time. The same time that you're logged in today is going to be our time. Because I work in the morning in the clinic, I have daily OPD. So I finish 5:30-ish, and by 6, which is my time, Saudi Arabia, I'll be ready to go online with you guys. So anything that you would want to talk about that particular topic, you can put it in the Telegram group and the WhatsApp group, and then we will talk about it in detail during the talk. So now, confused about correct clinical knowledge, sitting for 2 membership exam? Let's do an Irish and a UK guideline comparison. I'm just going to give you a brief of what to expect in the coming days, when we are doing the courses. Let's compare. What about early pregnancy loss? Okay, what about the HSE Irish guideline? What does the UK NICE guideline say? So as you know, with an early pregnancy miscarriage, there could be expected management, there could be an outpatient or medical management, or there could be a surgical management. A slight teeny bit of a difference. So when you are attempting the SBA and Irish exam, always remember for expected management in Ireland in the Early Pregnancy Assessment Unit, or EPAU. What is it? Early Pregnancy Assessment Unit. There is a 2-weekly ultrasound, and they keep in touch with the patient. The patient can come to the accident and emergency anytime, to come to the Early Pregnancy Assessment Unit at any time. If it is a medical management or an outpatient management, it has to be a mean sag diameter or an MSD of less than 50 millimeter, and we are giving them misoprostol or cytotec to be taken at home in 2 doses, 3 hours apart, which is 600 microgram. Now that's your difference from the UK NICE guidelines, where they are giving 200 milligram oral mifepristone first, and then 48 hours later, 2 days later, they are giving 800 mics of misoprostol, which is basically 4 tablets, either vaginally or orally or sublingually, unless the sac has already been passed. And then they see the patient back within 48 hours. In terms of expectant management, the UK NICE guidelines say they can have an expectant management for about 1 to 2 weeks, and they will do a urine pregnancy test at home. They are given the kit 3 weeks after the miscarriage. What about the surgical management? The Irish guidelines say surgical management can be offered on request or of change of mind if the woman does not want to have an outpatient management or something. Okay, can you mute yourself, please? Somebody has your microphone open. We can hear you. Who's that? Let me see. All right, okay. Never mind. So coming back to the surgical management, the UK guidelines say when clinically appropriate, but the Irish guideline has specified either heavy bleeding or risk of infection or trophoblastic disease, gestational trophoblastic disease, or molar pregnancy. And then what to do in Ireland, you are doing a suction curettage or ERPC, and in UK you want to do a manual vacuum aspiration in office or evacuation under GA. So albeit same, but a little different. Does that make sense? Show me a hi in chat so that you understand. So I move on to the next slide, please. Great. Okay. So after the early pregnancy loss, similar things, I mean, just to show you two things like an ectopic pregnancy, for instance. So HSE guidelines says expectant management for 3 millimeter, UK guidelines says 3.5. So very subtle difference again. And expectant management is for the beta HCG of less than 1500 and a mass of less than 3 millimeter. The UK guideline says beta HCG of less than 1500 millimeter, 1500 IU as well, but a mass of less than 3.5. So that's just a subtle difference in expectant management. Then the medical management, slightly different. Beta HCG less than 3000 for Irish and between 1500 and 5000 for British. And then can consider if serum beta HCG is between 3000 to 5000. Now, and again, the mass is less than 3, and in UK it is less than 3.5. Now, the most important thing is when you are attempting these exams, please do not come out and say, but this is not what we do in our exam. No, because you're attempting an Irish exam. So we are expecting you to answer what we are doing in Ireland. Does that make sense? Or if you're attempting a UK exam vis-a-vis, you're expected to know what happens in the UK, not what happens in your hospital. Like my practice in Riyadh may be different from the Dublin practice, and it's perfectly acceptable. But when I'm sitting in an exam, I'll speak the exam language, okay? So now, are you worried about the recalls or SBA? Now, this is where I want all of you to sit with us. Sit up, move, shake, and let's do a couple of on calls as well. A woman who has breast cancer at the age of 45 now has severe osteoporosis of the head of femur at the age of 57. Which treatment is most suitable for her? Biphosphonate, A, calcium and vitamin D, B, raloxifene, C, or tibolone, D. You can put your answers in the chat, please. C. Thank you, Isra. Anybody else? All of you. You're a very active lot. I can see that. Thank you very much. Start posting. Anybody? A. Biphospho. A. C. A. Excellent. 2 more and we are done. Oh, great. You guys are fast and furious. Okay, so this is like a fastest finger first. Well done, Dr. Shamiel also. So let's see what the answer is. All right, so biphosphonate is the correct answer, but hang on, we're not gonna stop here. Let's see. So calcium and vitamin D are just supplements. Raloxifene is selective estrogen receptor modulator, and tibolone is a HRT. Now, what were the buzzwords in this SBA? The buzzwords were breast cancer. She had it at the age of 45. Now she's 57, so almost 10 years, 12 years down the line. But she is severe osteoporosis of the head of the femur, so she's at risk of fracture. And the question, the buzzword is most suitable. Most suitable. Yes, you can give her calcium and vitamin, but they're not the most suitable. Raloxifene, no. Tibolone, no. So the most suitable will be biphosphonate. So that's how you attempt an SBA. Check the buzzwords. What are there? Go back to it again and again. And unless and until you do not finish your SBAs at least 2 times, or ideally 3 times before your exam. Everybody who has passed the Mrcpi before, you can ask them, you know, how many times they went through the SBA, the whole course. They will tell you at least 2 times minimum. And it is a very big advantage if you can do it 3 times, so that you know the language of the SBA. Now, the next one, a lady presents in the A&E, accident and emergency, at 36 weeks gestation with acute abdomen, with vaginal bleeding. On examination, she has a hard and tender uterus and a fetal demise. So what is the best option for her? What is the best option for her? All right, yeah. Oh my God, you guys are good. You guys are great. D, D, B, A, C. Excellent, excellent. Well done, Najla. Well done, Lubna. Thank you, Halima. Well done, all. Okay, so let's see what the answer is. All right, so the answer is emergency cesarean section. And the reason is why? Because all of the above, admitting her to observe is an unsafe option. You will lose her. Induction of labor, a big no-no, because she's acute abdomen and vaginal bleeding. And again, normal vaginal bleeding, all unsafe options. And here are your buzzwords: 36 weeks, acute abdomen, vaginal bleeding, hard and tender uterus, and fetal demise. So all that in your head should be extreme emergency. And what is extreme emergency? Emergency cesarean section. All right, let's move. Next one. All right. Yes, D, it is indeed, Dr. Lights. Okay, so a 65-year-old lady presents in the gynae outpatient with postmenopausal bleeding and a transvaginal ultrasound showing 12 millimeter endometrial thickness. She's taking aspirin. What is the most likely risk for her? A polyp, medication-related bleeding, vaginitis, or endometrial cancer? All right. The floor is yours. Oh my God, you guys are the fastest finger first. D, 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 D. Thank you, Halima. Thank you, Manikam. Thank you, Dabinda. Thank you, Lights. Dr. Osini, Dr. Nafia, Dr. Shami, Dr. Nazia, Dr. Lubna. Oh my God, you guys are a pro. Endometrial cancer. Oh, great. All right. Okay, so that's that. And then your buzzwords over here are 65-year, postmenopausal bleeding, 12 millimeter, okay, aspirin, but they're asking most likely risk. Most likely risk. That's the important word. And that henceforth is endometrial cancer. Otherwise, all of them can be true, but the most likely risk is that. All right. Okay. Final one. I promise you. A 29-year-old lady has been diagnosed prenatally with fetal omphalocele. She's being referred for an amniocentesis. What information will you give to the patient whilst counseling her? Number 1, A, it is done before 15 weeks of gestation. B, there is 1% risk of miscarriage. C, it is a screening test. D, mosaicism can give false negative results. All right, shoot. Okay, you guys are faster than my imagination. Well done, Lubna. Well done, Lais. Well done, Tahira. Well done, Halima. Well done, Dr. Osini, Dr. Nawida, Dr. Manikam, Dr. Shami. MashaAllah. All right. Okay. Bravo. Bravo, everybody. Everybody, bravo. Well done. Okay. So what's the answer? There's 1% risk of miscarriage. Why? Because that's the commonest thing. So when you tell her it is done between 15 and to 20 weeks or later, and it's not a screening test, it's a diagnostic test, and amniocentesis is done to detect mosaicism-related abnormalities. So now your buzzwords for this SBA were fetal omphalocele, amniocentesis, information, and counseling. So the first thing you tell them is that you're going for a test, but you may have a risk of miscarriage, which is 1%. That's the commonest thing first. And always remember, we as examiners, when we are setting the paper for you, when we are setting the SBAs for you, we are also human. And we also think of the first commonest answer first. So use your common sense, use your intuition when you're answering these questions. And then again, you may have again this commotion. What if I fail? Why did I fail? What if I fail again? You need to put everything aside. You know why we choke in an exam, or why we choke in, because A, we're not sure about ourselves. So when we are reading, when we are rereading, when we are discussing in a group, when we are discussing with a study buddy, when we are looking into all the guidelines and everything, that makes us very professional and prepared person. I will give you a personal story note on this one. One of my sons is a medical student in RCSI in Bahrain. So he had his viva for neurology, and he came back and he said it did not went very well. And I will start reading about it again just in case if I fail. So his results are still 2 weeks away, and he's coming home and is sitting for that. So I asked him the next day, I'm like, how are you doing? Are you okay? And he said, yes, I reflected on that. And my thinking is that, the first 6 questions I answered very well. The next 2 questions were difficult, but I feel that everybody would have found them difficult. And then the 3 questions I'm unsure about. All right. So in my reflection, I would say that, I may just score a borderline in that, but it will cover with my, so this is the kind of a candidate who knows what he's doing and what he's saying. So now, and remember, he's my son. His age is like 22, 23 right now. And I told him, I said, do some reflection, sit down and everything. And he tells me, Mama, we have been doing this practice, what you're telling me, since my school days. So I think it is something which your generation need to realize. I got my message from a Gen Z. So your generation need to realize, which we know already, we reflect and we sit back and we give ourselves, some brownie points as well. So again, you need to have some me time. You need to be less strict on yourself when you are overthinking after an exam. And you are making a difference every day. Always remember that. Okay. Now, the exam boosters that we are going to offer you would be crash recall revisions and your confidence building and nerve calming sessions. That is very important because most of you, when you come to me towards the end of the exam, it's very important that you understand that, your calm nerves, your full sleep, your good health is very important. These things are also important, as much important as your clinical knowledge. So look after yourself. And on this note, I'm going to just give you a small, in order to succeed, our desire for success must be greater than our fear of failure. That's the answer of what, if, why. All right. So the decision you're going to make today and all the study you're going to do now and onwards until September will be worth it in the end, I promise you. And with this note, I'm going to wish you best of luck. I think Aisha is going to take the floor to explain to you further about how to apply for our course then. And we are ready for questions in the chat box as well. Aisha, are you online? Yes, Dr. Sadia, the recall will be in the main course.
Yes, thank you.
Okay. Miss Aisha, are you online now?
Yes, ma'am.
Excellent. All right. So you want to share your slides now? I will stop sharing. Okay, there will be a crash course as well, as I said. Yes, Lubna, please do not call me madam. Just call me Shazia. That's absolutely fine. No ma'ams, no madams here, okay? God bless you. I already went for exam once before. Now I must apply the paper again for September exam. No, Dr. Najla, no. This is only for the first time timers. When the med exam expert course is starting, Miss Aisha is going to, share her screen. I'm going to stop sharing here. So, Ms. Aisha, you can share your screen and tell everybody when the course is starting, please. Thank you, Dr. Tabinda. That's so kind of you, my dear. What should be the percentage of guidelines, trading, and SBA practice daily? It really depends on you. Just build it up. Like I would say, start from 2 or 3 pages, and then you can build it up from there. Like for me, at the end of my exam prep, I was doing 1 book a night. So, please, is it easy to apply for exam for first time? Yes, Rodi, it is indeed. This talk that I have done, if you joined us late, all the details of how to apply are in this presentation. And then you can use this presentation later onwards to see, and then you can join our course. So there's so much more, in our course that we will be offering you all. So Aisha, are you going to share your screen?
Yes, ma'am. It's just starting.
All right. Okay. You go ahead. Go ahead. Thank you. Is it necessary to finish all MCQ books? We will be doing most of them for you, Dr. Lubna, but it's always the more the merrier. And please do not call me madam. Someone told me that there is waiting list to accept candidate. No longer. Sinead Freeman is the name of the secretary for exam. She was here last week, and she gave me the good news that all the exam slots are now open, and they have increased the exam slots since the exam is now online. So don't worry about that. Also, the exam head for the Mrcpi, her name is Dr. Mary Higgins. She was here last week with us. We had a great time invigilating the exam for the 2 days, and we had a good insight into, how the international candidates are working, how hardworking they are, despite the fact that they are juggling between their life and their work together. They are performing very well at the exam. And Mary and another consultant, her name is Kathy. She's from Drogheda, which is a small town near Dublin. So, and Kathy is working in Our Lady of Lourdes Hospital in Drogheda. She was one of the chief examiners, and Dr. Mary Higgins, she's the head of exams in Mrcpi for Obs and Gynae. She's working in the Holly Street Hospital. So they were giving us an insight that they are very, very interested in knowing, how you are preparing. There were a few feedbacks in the OSCE as well, which we will discuss in the OSCE sessions, inshallah, how to prepare you robustly for an Irish exam. And believe you me, we are going to have fun. So even OSCE will be online? No, Dr. Najla, OSCE is going to be on site. OSCE is not going to be online. You're very welcome, Dr. Rodi, and Dr. Nazia, you're very welcome. Any other questions before Aisha is getting ready for her slides?
Ma'am, please allow us to share the screen.
Yeah, you're already sharing it. I can see your screen.
Yeah. Hello, good evening, everyone. I'm Aisha, course manager from Team Med Exam Expert. Thank you so much for all of you to join us in today's session. And thank you so much, Dr. Shazia, your valuable contribution for this wonderful information webinar. So let's begin, and thank you so much. So students, for next, we will start that here is our page and link available in front of you. Please visit our official website, or you can contact me on this number, which is available on your screen right now. So our next page, please. Yeah, it's available on your page, right? So you can visit our official website. There are a few different steps, so you can follow easily. You guys can visit our official website, Med Exam Expert, find Mrcpi 2 written back September. So just click on this. Just from the starting, you can take a screenshot easily. So you can just listen me and you can follow the steps easily. So you can find the course in our website. First, you have to visit our Med Exam Expert LMS website. Second step is just click on Mrcpi September batch course. There is a course appear, and this screenshot is also available in the screen, so you can see there is a complete course, regular course available. After that, you have to click on this select payment option. There is a complete payment option on the screen, right side of the screen. There is an option, just click on a payment mode. Just it's your choice if you want to pay in full payment or you want to pay in installments option. Just click on this option. After that, click on the payment mode. After that, you guys can click on the batch. Batch is September 24 batch. After that, add to the cart. Click on online checkout, enter your card details and enter all your required details so you can go easily. then you can select the payment mode. So you guys can proceed easily. If not, then you can go over next page that you can add or you can click on this link and you can add your details. If not, then you can contact me. My contact number is available on the screen, so I will help you as well. For those who join us in today's webinar, we have a surprise for our students. There is a discount voucher available on the next slide. There is an voucher named WEBMA31. So you all can note this down. Take a screenshot. You guys can note it down and send me a text on a given number. The number is available in the screen right now. So you can send me a text. So I will share a link with you all so you can join us with the discounted fee. So once you all can provide me the coupon code, then I will share the link with you so you can join us and get the complete regular course with Dr. Shazia and Dr. Tahira. So you will have the access of a complete course from your joining till the September exam date. So after that, you will have the access of all the summaries, guidelines, and everything which is Dr. Shazia has already shared it with you. So thank you so much from my side. And now over to you, Dr. Shazia. If you guys have any question or any query, you can contact me. I just add my number in my chat. So thank you so much.
Thank you very much, Ms. Aisha. Thank you very much, everybody. I hope you all would have benefited from this. I think Dr. Nafia is online. If you want to unmute yourself, Dr. Nafia.
Thank you, Dr. Shazia. Good evening to
Welcome,
everyone.
Dr. Nafia just passed her Mrcpi 2 written exam. How was your experience with the exam? How did you find the prep?
Yeah, Dr. Shazia, first of all, I really want to thank you for being with me in every step of my studies journey. And really, I am very lazy before, and she's the one who motivated me to start study after a long gap. So, Alhamdulillah, you are the one I will really want to
You're
say
so
that.
intelligent, Nafia. I told you can do it, you know.
Really, you are the one who just motivated me every step, and you teach me how to manage my time, because I am working with her luckily, and really it is a very, very busy schedule with us. Every day we are working 9 hours, and Alhamdulillah, she is the one. She guided me how to manage time, how can I start my studies, and really the most important thing is that the focus study is very important, and I can trust really blindly. We can follow the group, we can follow the Mrcpi schedule and their lectures and their module. So even from the day one, we start very slowly and with very, very proper time management, timetables. Really, I did my MRCOG1 with Mrcpi. I did my Mrcpi with them, and it was an amazing journey. So I will really recommend everybody that, mashallah, if you have a good mentor, if you have the best person with you, he can take you off very nicely. You can fly very high, inshallah, in your future. So thank you, Dr. Shazia. You are the
very much, Dr. Nafia. You rock. And then, as I told you, you know, there's the sky is the limit for you, for Dr. Uzma, for Dr. Rehab, everybody who's going through the exam journey. You know, the sky is the limit for Dr. Sajila, for Dr. Tahira, Dr. Azza. You know, everybody has their own success stories, have their own ups and downs. We have been through together, and I'm sure that, you know, I mean, for those of you who are listening, once you join us, you will feel the difference, because, you know, we are very much keen into developing you as a wholesome 360 personality, not just passing your exam. Conquering your exam is about having a positive attitude, having a good health, having good, time management, as Dr. Nafia correctly said. And we are very, very keen on, you know, focusing on sort of chiseling you and making a individually tailored plan for all of you, because not everybody is the same. Not everybody's circumstances are the same. That's why I always encourage you, you know, when we are in a live session, introduce yourselves, let us know where you're coming from, so that, you know, I mean, not only we break the ice, but we also know about each other's, you know, shortcomings as well, so that we can focus on those specific points. Like, Some of you would have said that, you're very busy and you're doing on call, so you will hear to the recording. And we said, no problem, just we will record it for you and you listen. But then you need to make a commitment to yourself, not to anybody else, not to Mrcpi, not to me, not to anybody else, but you need to make this commitment to yourself that now I am ready for the exam and now I am ready to crack the exam. And that will be the time where you will be focused and you will know what exactly to do. I finished 2 of my exams when my kids were 6 years and 1.5 years. Okay, so we know what is the struggle with small children. We know what is the struggle with job. I was working, very hard in the Rotunda Hospital in Dublin when I took my exams. So we know your stories. We know your struggle. But believe you me, there is no ideal time to sit for the exam. If you think your kids are going to grow up and then you're going to sit the exam, that's not an ideal time. There will be other problems. If you feel that you will take a 1 month off or 2 months off from your work and then you will sit your exam, that's never going to happen. So you need to make room for what your circumstances are. That is very important. So Dr. Wajia, 2011 is a bit longer time. Dr. Wajia is asking, what can I do as I have passed FCPS in 2011? What options are for me? So no, you have to find a separate way of appearing because it's 6 years time window usually. So thank you very much on this note, everybody. And I hope you all enjoyed. I enjoyed the session thoroughly. I enjoyed connecting with you all. I already feel the connection with you all. There's a patriot. He wants to talk. Yes.
Dr. Shazia, sorry, I'm a Managing Director, Medexam. Mozam, how are you?
Hi, Mr. Mozam, how are you? Salam alaikum.
What a pleasant to hear you once again, and it's always wonderful to hear you. And what a lively voice you have, and what a pleasant demeanor and the way you're conducting such a wonderful lecture. Always heartening to see you. And I'm really, once again, obliged and welcome you on behalf of Medexam team for joining us. And we are lucky to have such a professional. I always welcome, ma'am. And I'm really very happy to listen. Nafia also, Dr. Nafia.
Thank you, Dr. Mozam. Thank you very much. Nice to hear you.
With your likewise.
Thank you.
What I can suggest by meeting these two professionals, I can only recommend everybody is that please stay connected with such a professional, stay connected with the Medexam team, and we'll make our best efforts to make you through your very challenging professional exams. And I can bet that you can not find the better professionals than them in this time at such a tech platform. Dr. Shazia, once again, thanks a lot. And from my side, the loud applause. And inshallah, we'll be in touch. Thank you very much for the patience hearing.
Thank you very much. Jazakallah khair. Thank you so much. And thank you, everybody. I'm already receiving messages on my WhatsApp. Many of you already know me in Saudi Arabia, and everybody has my phone number. So you're all very welcome. Once you join the group, everybody will have my phone number. And we are a team of very dedicated professional mentors who do not have any qualm in answering your queries any hour of the day. So just rest assured that we will be with you till you pass your journey. And it does not stop over there. Then out of you, we will be choosing the new mentors, the new examiners for the exam as well. Because this is the success story of everybody that's in front of you, like Dr. Sajila, like Dr. Tahira. They pass their exams and then now they've become the examiners for the Mrcpi. So these are all success stories within our community. So I just want to tell you that, you are only one step away from taking that correct decision today. Thank you very much.
Thank you, Dr. Shazia and everybody. Thank you, Ji.
Thank you so much for your mentors. Thank you, everyone.
Thank you very much, everybody. Bye-bye. Assalamu alaikum.
Welcome. Thank you. Allah Hafiz.
Allah.